So last week we spent some time broadly talking about what the immune system looks like. In this set of slides, we'll briefly introduce what the immune response is to various infectious agents. So this is a table that you can definitely refer to as the semester goes on. The different types of infectious agents, bacteria, intracellular bacteria, viruses, fungi, and parasites, and what parts of the immune system, what types of immune responses are most common. So the more plus signs that are shown, the more strong that particular part of the immune response is to that infectious agent. And again, as we think about these different infections, as we talk more specifically about particular organisms, we'll talk a little bit more about what types of immune responses are most important. Here we have just a diagram showing a lot of stuff that occurs during an antibacterial response. So in this case, what they're trying to illustrate is that the patient has had a breach in the skin, maybe by a splinter that has introduced some bacteria into not a very deep wound, but a wound nonetheless. You have various innate responses, including neutrophils, dendritic cells, macrophages. You have the release of chemokines. So these macrophages that respond, right? You see they phagocytize the bacterium. That can activate more dendritic cells. That can lead to activation of B cells, natural killer cells. You start to see activation of our T cells. And eventually we get memory cells, and then these would be plasma cells that secrete various antibodies. And we get response pretty much right away with some of our phagocytic cells, with the release of chemokines, with neutrophils. These are PMNs, are a type of neutrophil that are moving into the area within 4 hours to, maybe like 4 days or so. You start to get this dendritic cells that are activating B cells, and you start to get these antigen-specific responses within 4 to 6 days. So again, really what's helping the cleanup of that type of infection right away is going to be your innate immune system. And you may not even know that you've got an infection because the innate immune system can clean it up pretty quickly. Sure, you'll experience the symptoms of the wound, which would be pain, maybe some bleeding, redness, swelling, but you may not see that it's a big nasty infection because your body is working really hard to clean it up right away. A number of different bacterial molecules can activate those innate responses. On gram-positive cells, that'll be things like teichoic acids. Gram-negatives, the lipid A, or that component of the LPS. Peptidoglycan in both types of cells can also bind to those pattern recognition receptors, which will lead to the production and release of various cytokines. Pro-inflammatory cytokines like interleukin-1 and tumor necrosis factor alpha will activate that rapid acute phase response, which can also lead to the release of antimicrobial peptides. And so anytime you've had one of these little wounds, you probably know that there is that localized inflammation. And like we've talked about with the innate immune system, that local inflammation and swelling is due to the cellular proliferation. It's due to cytokine production, where those cytokines can lead to vasodilation, release of fluids, and release of cells. The broad phagocytic response is mediated a lot by chemokines that attract phagocytes to that site of infection. Things like neutrophils, which we saw in one of the previous slides, and macrophages. Of course, phagocytosis is phagocytosis. It's not super complicated to talk about. And then especially dendritic cells, but also to some extent macrophages, will present antigens to T cells and B cells to initiate that adaptive response or antigen-specific response. Here we're showing a dendritic cell. It has phagocytized an antigen. So it's an immature dendritic cell. That's what I means. And then you get the release of cytokines. This dendritic cell then matures and can present antigen to naive T helper cells that haven't differentiated yet to T helper 1 or T helper 2. It can also present antigen to already existing CD8 positive T cells. And as we have that antigen presentation, you can get differentiation depending on which cytokines are produced to those T helper 1, T helper 2, which can activate more B cells, macrophages, and dendritic cells, and can also lead to various memory cells. For our antibody response, the B cells are most often activated by helper T cells. A lot of times people talk about B cells are the ones that release antibodies, and that's not entirely accurate. B cells differentiate into plasma cells, and plasma cells are really the antibody production factories. So if you look at a plasma cell under a microscope, there's a ton of like endoplasmic reticulum and Golgi, because that's really important for the site of immunoglobulin or antibody synthesis. The first antibody that is produced that is going to be specific for that particular antigen is going to be IgM. Then we'll have some class switching occur, and we'll get the production of IgG. So when you have higher levels of IgM compared to IgG, that would indicate an early or primary infection. When you start to see higher levels of IgG than IgM, that's indicative of a late infection or a secondary infection. We can also have class switching into IgA. IgA is the antibody. It's secretory. We find it in saliva, mucus, GI tract. It's the one that protects you on all of those types of surfaces. And we can have IgE, which generally serves as our antiparasitic antibody, but also can cause allergy symptoms. So in the US, we tend to not have too many parasitic infections, so we mostly see IgE as that allergy response. Our antiviral response is going to be slightly different, so we're not going to have that type of phagocytosis that we see with the antibacterial response. One of the first things that we'll see during an early viral infection, and so here what we're looking at is influenza infecting the respiratory epithelium. One of the first things that we see is the production of interferons. So remember, interferons are going to be these broad cytokines that are antiviral. Those can activate natural killer cells. We can also have some of these activated macrophages, which can, both natural killer cells and activated macrophages can induce these infected cells to undergo apoptosis. And then the macrophages can come in and clean up the cells that have undergone apoptosis. Remember, really what we have to have happen with a viral infection is two-pronged. We have to have our cellular immunity, which will be mediated by T cells, and we have to have our humoral immunity, which is mediated by antibodies. And that's because antibodies are great for going out and neutralizing viral particles, but once a cell is already infected, the only way for that cell to really clear the infection is to undergo apoptosis. And so what you're going to get is a pretty broad apoptotic, high levels of CD8 positive T cells that are going to go and tell these infected epithelial cells that, hey, sorry, you got to go. So we have both of these responses. And again, this would be like a primary infection. So you have 0 to 4 hours, this broad innate response, an early antigen-specific response, 4 hours to 4 days, and then a really strong late antigen-specific response after 6 days. Now, if you've already seen the infection before, either because you've been infected before or because you've been vaccinated, this can occur more rapidly, the production of antibodies and the production of the cytotoxic T cells. So interferons, one of the things they can do, and one of the symptoms of a viral infection that I think we're probably all familiar with, is the fact that you get a fever. So the fever is important because it can destabilize the virus. Many viruses are really only good at replicating at body temperature, and when you tweak that up a few degrees, it can make it far more difficult for them to replicate. Phagocytic cells can engulf free virus. It's easier if they've been tagged with antibodies already. But as I mentioned before, those phagocytic cells can also be really important to pick up the cellular debris. So when a cell undergoes apoptosis, they come in and clean up that mess. Your phagocytic cells also, especially your dendritic cells, but also remember we talked about class 1 and class 2 MHC, and class 1 MHC is found on all nucleated cells. So any infected cell can basically say, oh, I got a problem, and that can lead to activation of cells of the immune system, right? Hey, I'm infected. And that can also be, hey, I'm infected, and then the cytotoxic T cell comes by and says, sorry, gots to go, and lead to that apoptotic state. Natural killer cells also will come in and clear those virally infected cells, and interferons can activate the immune response and enhance T cell activity. So once those T cells come in, interferon can really ramp them up. So here we're showing, what is going on. You've got a virus that's infected a cell, and what we want to have happen is this dead infected cell. This makes it look really easy. So the infected cell can release interferons, which can lead to an antiviral state. And so you have things like kinases that are activated, and the cell can begin to do things like degrade its own mRNA, inhibit its own protein synthesis, because the idea behind a viral infection is that a virus wants to get into your cells, and it takes over your host cell machinery. So instead of making your own RNA, instead of making your own proteins, you make the viral RNA and proteins. So if the cell can shut those things down, that can also prevent the virus from replicating. With our adaptive response or our antigen-specific response to viruses, we see that antibodies will coat the viral particles, and that can serve two purposes. One, opsonization is basically that sign to tell a macrophage, hey, I'm tasty, come eat me. Whereas neutralization binds the virus and prevents the virus from being internalized to a host cell. We also get the recognition of virally infected cells by things like T cells. We can also see the antibody-dependent cellular cytotoxicity, which is by natural killer cells. And what happens in this case is if an antibody binds to an infected cell, because the cell is showing viral antigens, the natural killer cells can come in and kill those cells. And of course, the CD8 positive T cells, which are also called the cytotoxic T cells, will lead to apoptosis of those infected cells. Finally, with our time course, it's going to look sort of similar to our bacterial time course, where the innate immune response is most important during the early days of infection. And then eventually it will switch over day 5, 6 to the adaptive or antigen-specific immune response, taking over to help clear out the infection. And so you'll see a peak of virus-specific CD8 positive T cells, the cytotoxic T lymphocytes. You'll also see the viral-specific antibodies peak. And again, what we're looking at here is a primary or the first time you've ever been infected with that virus. So if a patient has been vaccinated or has seen the infection before, this will scoot over to the left and you'll get the proliferation of the virus-specific cells and antibodies much more rapidly. Of course, we have these great responses that we have evolved to help us fight infection, but the pathogens have also evolved responses to get away from us. So viruses, and we'll talk about this when we talk about specific viruses, how exactly they do this, but viruses have a lot of mechanisms for how they can escape us. They can hide from antibody. They can vary their antigens on their surface. They can secrete antibodies or antibody-like molecules that block antibodies. They can block the production or action of interferon. They can impair dendritic cells or lymphocytes. Some viruses even infect lymphocytes. For example, HIV infects T cells. They can cause decreased antigen presentation. So basically, when you have that happen, the host cell can't signal I'm infected, because it's not showing antigens anymore. And they can inhibit the inflammatory response, including fever. So for every mechanism we have to fight viruses, there are viruses that can fight us back.